Hi, myself is Vishwa Prasad. My subject name is Hospital Management. My title is Importance of Nutrients in Hospitalized Patients during malnutrients. The World Health Organization define malnutrition as the cellular imbalance between supply of nutrients and energy and body demand for them ensure the growth, maintenance and specific function. Manual nutrition remains very prominent in both development and developing countries deficit ongoing awareness campaigns. Quality of life, increase length and stay in hospital, increase the risk of unsuccessful outcomes of treatment, failure to acknowledge the risk of malnutrition can seriously impact of mortality, mortality rates. Decreased food intake represent an independent risk factor for hospital mortality. Clinical nutrition. It's a recommended that nutrition supplement be offered the patients or those high risk of poor dietary intake at recharge from hospitals. It can be recommended that great effort should be taken to increase the protein energy food and oral supplement for patient with eating problem in order to prevent the treatment under nutrition. 6 trials with 10,187 randomized participants have been included the review. Supplementation produce the small but consistent weight gain in older people. Mortality may be reduced in older people who are under risk. They may also be beneficial effect on complications. 55 trials were include 9,187 randomly assigned participants for patient short-term care hospital who were give oral supplements evidence suggested. Fever complication reduced mortality. Oral nutrient supplements can improve nutrient status and some reduced mortality and complication for elderly patient in the hospital. The study included 817 patients. Patients were malnourished. In hospital patient, malnutrition range between 30% to 50% and is associated with a higher rate of complication, prolonged hospitalization, increased cost of health service, malnutrition in hospital, shoving, digesting food pain, nerves, and a lack of appetite. Nutrient loss can be accelerated by bleeding, tryptorrhea, malabsorption disorders, other factors. Hospitalization usually due to sepsis, sepsis, inflammatory disease under surgery. Switch on inflammatory mediators whose job is to mobilize muscle tissues to provide amino acid for an effective acute pace response. Consequences of malnutrition, reduced renal function, impaired wound healing, constipation, dysuria pain, respiratory failure, skeletal muscle atrophy, increased length of stay, surgery stress, increased metabolic rate, reddish hair, atrophy of tongue qualified. Sign associated with malnutrition, hair, face, eye, lips, tongue, teeth, gums, gland, skin, nails, muscular and skeleton system, internal system, diagnosing malnutrition, laboratory studies, serum albumin, serum transferrin, retinol binding protein, serum potassium, hypermetabolism. Most common causes of hypermetabolism are fever, infection, fracture, prolonged steroid therapy, hyperthyroidism, species, multiple termia surgery, protein recovery, blood stress 0.8 to 1 kg, serve stress 1.2 to 2 kg per day, Thank you for the giving this opportunity. Share my title for malnutrition. Thank you.